Hello everyone, this is Fungai K, and I'm here to demonstrate an assessment of a newborn baby, and I'll be using this baby doll as my baby. So first of all, when I walk into the room, I make sure I perform all my hips, and after that, then I make sure that the baby is safe. The baby is at a safe space. Then after that, I put on my gloves. I use my gloves. Then the first thing before I do anything, I just check the baby to see if the baby has got a normal skin tone, just anything, just by observing the baby's reaction. Maybe the baby will be sleeping because babies sleep more. So the purpose of this assessment is to assess how the baby is adapting to life out of the uterus. So right now I'm going to start by taking the vitals, maybe respirations and heart rate, so that I don't have to upset the baby. So what I'm going to do first is make sure I take the weight of the baby. So I put, we use those small scales for the baby, and I put the baby on the scale to measure the weight of the baby. Then after that, I'm going to measure the height of the baby. So I make sure I put the baby lying down flat on the bed or any sheet. Then I make sure to measure from the sole of the foot right up to the top of the head. Then I make sure I'll be documenting that. Then next to that, I make sure I also take the baby's temperature, making sure that I go right in between the baby's armpits into the skin, making sure I'm not just taking the blanket's temperature. Then after that, I make sure I take the respiration rate for the baby. Usually with newborn babies, it's supposed to be around 30 to 60, and I take for 1 full minute, 30 to 60 respirations per 1 full minute. Then I also make sure that I measure the heart rate. Make sure I listen to all quadrants of the heart. And I also make sure that I'm using a small, maybe the bell side of the stethoscope or the ones for the peds. Making sure I listen to all the heart sounds. And normally the heartbeat for the baby is supposed to be from 110 to 160 beats per minute. Then after that, I make sure I start my assessments. So for the assessments, I first uncover the baby and just have a brief, just make a brief assessment of the skin tone, of just anything which might look out of the ordinary for me, just any bruises or anything like that on the baby's skin. And one thing that I want to point out is that with new babies, what happens is that they've got that acne on them. That's quite normal and it's quite expected, as well as maybe some red spots here and there. So for the assessment, I'm going to start from the head, going all the way, just like how I would do with an adult or a big child. So I'll start from the head, going all the way down. And with this assessment, it's the second assessment after the first APGAR scale, which would have been taken, of which with this one it's also vital, so that we can also, it's taken after 5 minutes of birth, just to make sure how the baby is also adjusting to life out of the womb. So I'll start with the head, and I make sure I feel the head, I feel the anterior fontanelle, which is supposed to be soft and smooth, and it's a little bit bigger than the inferior fontanelle. So I start feeling from the top of the head, feeling all of from the head, and check if there is any molding or anything abnormal about the baby's skull. I also make sure that make sure that I palpate the head and just make sure that everything is quite normal from the head. Then I go next to the ears. I make sure the baby has got 2 ears, normal, and after that I go and check the baby's eyes. Sometimes the eyes might be swollen or anything, but that's quite normal with babies. And I also check the nose. Because babies are obligated nose breathers, it means that it is very important for the nose not to be blocked or to be stuffed or anything like that, because they feed mainly through their mouth. And for that feeding to be successful, the nose has to be clear. So I make sure I check the nose. I make sure I check inside the mouth too, just to make sure that everything is fine. Then for the reflexes, I have to check on the moral reflex for the baby. I just stroke on the cheek of the baby and see if in a normal baby, the baby is supposed to follow like the tip of my like my finger following like for food. It's a reflex that's normal in babies. So after that, then I just go to the neck. Then I start palpating on the neck, going all the way, just making sure that the baby is okay. And I make sure I also check the clavicle of the baby, feel the clavicles and see if the clavicles are normal, because sometimes when the baby is getting out of the womb through the birth canal, some babies might dislocate or maybe fracture their clavicle. So this is an important part of the body to assess on babies. Then after that, I go to the hands. So to the hands, I feel the baby's hands. I palpate them and make sure I check the baby's hands, the fingers, make sure the fingers are all separated, and then there's 5 fingers on each hand. This is very vital too. In babies, you have to check almost everything on the baby. So and after that, then I start just checking the baby's skin on the stomach and the chest, just to make sure that there is skin tone on the baby according to ethnicity. So as I mentioned before, that it's normal to maybe find some acne on the baby or find some red spots on the baby. It's also normal. So I also now go and listen to the skin. I'm sorry, excuse me, because I've got a baby in the house, so he's just being naughty. So the next thing, I'm going to listen to the baby's lungs. And as I'm listening to the lungs, I make sure I listen from the sides too, in all quadrants, just to make sure that the baby is breathing normally in all quadrants. And I'll also listen from the baby's back in all quadrants too. And I'm going now to listen to the baby's heart. I'm going to listen to all the quadrants of the heart too. Then if everything else is normal, I then progress to go and listen to the baby's bowel sounds. It is important to listen to the baby's bowel sounds before I palpate them, so that I don't disturb the bowel sounds. So I listen again to all the 4 quadrants and see if I've got a normal gagging sounds from the stomach of the baby. Then after that, I'm just also going to inspect the back of the baby, the skin and everything else, to see if it is normal. And also I'm just going to check another reflex, the palmar reflex on the baby, and to see if the baby is going to give me a normal reflex. I'm just going to put maybe my pinky or my thumbs into the baby and see if the baby is going to grip. That's another reflex which is important to check in babies too. So right now I'll proceed to go to the legs. And on the legs, I'm just going to inspect the baby's legs and go to the toes and make sure the baby has got 5 toes on each leg too. And I'm going to also check on the Babinski reflex too. So I'm just going to stroke the baby's foot and see the baby's reaction. He's supposed to flaunt his toes and open them wide in response to my stroking. And then I am going to listen to the pedal pulse on the baby to see if the pulse is there. And so after that, I'm going to make sure that I also not forget to check the umbilical cord for the baby. I should make sure that I see 3 blood vessels there. I should make sure I see 2 arteries and 1 vein on the umbilical cord too, and make sure that there's no drainage or anything going on or some hernia on the baby, which is very, very important. Then after that, I'm going to check on the baby's genitalia too. So I check to see if it is a boy. I have to make sure that I check if the boy had a circumcision or whatever is going on, to see if the site for the circumcision is okay. And I also check to see that there's the urethra, the testicles have also descended. And I also make sure that, and on a girl, I also check if the vagina has got is normal with a straight line in between, and that the meatus is not really bulging out. And it's normal too to see that there will be some pseudomenses. It's normal with the babies because it symbolizes maybe some hormonal changes too. And it's also a little bit normal to see the genitalia area a little bit swollen. It's normal. It's quite normal in babies. And then I also check in the anal area to see if it is normal. And then after that, I go on to flip the baby. So I flip the baby just to check the baby's spine. I also check how the baby is also balancing on my hand, the neck balance, and I also just stroke on the spine, on the spinal cord, to just see if there is anything which is abnormal, maybe dimples or pimples or anything abnormal about the spine, which is very, very important in baby because it is going to help especially in the diagnosis of some spinal problems too with the baby. And as I'm doing that, I'll also be checking the skin and everything on the baby too. Then I'm also going to check reflexes also on the legs. I'm going to check also the Babinski reflex on the legs, or actually the palmar reflex, to see if I stroke or if I stroke the baby, if the baby's feet are going to respond, and try to maybe clutch on my fingers too. So with babies, what happens is that they're supposed to at least void within the first 24 hours of the day, and also to pass meconium, which is the first 2, which is like a dark greenish black in color, which is normal, to show that their bowels are now functioning well. And also yeah, I think that is all. Then after that, I make sure I swaddle the baby back, and I think that's the end of my video. Thank you for watching.